Welcome back to another Senior Learning Institute's educational moment, where older adults and their loved ones turn for honest and straightforward information. In just a few minutes, you'll enjoy bite-sized, easily digestible nuggets of knowledge, empowering you to make the right decision the first time. So without further ado, here's our founder, certified senior advisor, seniors real estate specialist, nationally syndicated podcaster and speaker, the advocate you can trust, Mr. Ted Gottlieb.
Welcome back to another Senior Learning Institute educational moment. I'm Ted Gottlieb, founder of the Senior Learning Institute. This is podcast 5 of 5 on Medicare. If you've listened to the other 4 Medicare insurance conversation, it's now clear that Medicare has lots of moving parts, and working with a licensed Medicare insurance specialist is smart and it's free. This conversation features Medicare Part C, which is Medicare Advantage plans. Randy, we've hinted that those who want to enroll in Medicare insurance programs have 2 options. First, there's traditional Medicare Parts A and B. Then you add a drug plan and a supplement to limit our out-of-pocket exposure. And second, and the less expensive option, is enrolling in Medicare Advantage. We're hearing about it all the time, lots of advertisements. We'd love for you to explain what Medicare Advantage plans are and how they differ from the 3-step approach that we call traditional Medicare.
A little history. The original Medicare laws were passed in 1965, and then Part C of the law came along in 1985. So after 20 years of insurance companies interacting with the federal system by providing Medicare supplements, they basically lobbied Congress in the early 80s and said, we'd like to play a bigger role in the Medicare system. And they offered an alternative whereby an insurance company would assume the government's obligation to pay for claims in exchange for a government subsidy paid to them from the Medicare trusts. And in essence, it's like a subcontract deal. All right, you give us the subsidy and we'll take all the risk and all the responsibility for those members that enroll in these Medicare Advantage plans. If you didn't understand that subsidy was paid, there'd be a tendency to say, why do I have to pay like $150 for a supplement and another $50 for a prescription drug plan? And you're telling me this Advantage plan has a 0 premium and includes a drug plan, or it's a PPO plan and it only costs $30 and includes a drug plan too. When you understand the subsidy, okay, that's why you can purchase a very effective plan for substantially less than buying the supplement or Medigap plan and the standalone drug plan. So when I started in this business in 2007, there was about 19% of all Medicare beneficiaries were receiving their benefits through Medicare Advantage plans. It's now between 35 and 40%. So it's become much popular in the last 13 or 14 years. Again, one of the other things that makes Medicare Advantage plans attractive is it provides some benefits, additional benefits like dental, vision, that are not provided either by Part A, Part B, or Medicare supplement plans, okay, and the drug plans operate the same. So it's pretty convenient and pretty inexpensive way to get your Medicare benefits through a private insurance company. There are about 20 in my zip code here in suburban St. Louis. There's like 26 different Medicare Advantage plans that are available from a multitude of carriers. Oftentimes people are surprised that they can be very similar and in some cases, pretty different. So it's worth the while to basically kind of take a quick look through and evaluate the plans. That's why I think working with a broker rather than just a salesman who sells for one company or one particular plan probably works well for most of your potential clientele.
So, but when it comes to Medicare Advantage, and whenever I hear something that's going to cost me virtually nothing and have all sorts of benefits, I start to get concerned. So, pardon me for having that mindset. Maybe we can dig into that a little bit. but let's talk about the different types of Medicare, of Advantage plans, Medicare Advantage plans that are out there, because I believe there's an HMO and a PPO version of it.
That tends to be the basic division. An HMO is a health maintenance organization, is what HMO stands for. This is a form of managed care. And managed care means you have a care director, and that care director is referred to as your primary care physician, or PCP. All right. Medicare HMO Advantage plans basically require you to have a primary care doctor. They require you to get a referral from that primary care doctor to see any other doctor. They also limit the doctors that you can see to the ones who are members of the network of that plan. All right. So there's some limitations on who you can see. There's limitations on even other doctors in the network. You still have to get a referral from your primary care physician. The purpose of that is to basically manage care for people who maybe, don't have the time to, or aren't that, involved in their health plan. That allows that primary care physician to basically guide through and make sure that you're not getting redundancies and that type of thing. That's the concept. The alternative is to do a PPO plan, which stands for Preferred Provider Organization. So a PPO plan still has a network, okay, but number one, it doesn't require that you have a referral to see a specialist. So I don't have to ask my primary care doctor if I decide to go to a urologist, okay, I can just go to that urologist. The other thing it does is it allows me to go both in network at a lower copay, or if I choose to, or I have a reason why I need to go out of network, I can do that and still get most of the bills paid. So when you compare HMOs and PPOs, all right, the key feature there is you have some additional flexibility with providers and facilities, and the possibility of going out of network if you need to or choose to. And the other thing is you don't have to have referrals to see other doctors.
So PPOs are a little bit more, or I wouldn't say a little bit more, PPOs are more flexible in regard to the doctors I see, and I don't need to stay in network.
That is correct.
So if I am someone who is a snowbird, I live half the year in St. Louis and half the year in Florida or Arizona, whatever it's going to be, is an HMO going to work for me?
Some of the HMOs, some of the companies have special provisions for being, we call it passport. It's where they have provisions where you can use the network in Florida of that particular company when you're in Florida, and then come back to St. Louis area and use the network back there. For the most part, however, there's limitations there. I get a bit uncomfortable if someone who does that is going to be in an HMO, because I get concerned that they're going to need something on an emergency basis or something else, and they can't get a network provider, and then they're stuck. There's a lot of talk these days about surprise billing, both in Congress. I see it on TV, and I was in Washington, D.C., in February, and there's legislation being considered in both the House and the Senate to eliminate surprise billing. But for the current state of affairs, I happen to be a fan of PPOs because there's substantially less chance that people are going to get a surprise bill for care from someone who wasn't in the network. HMOs can still work very well, all right? But for people who are pretty, involved, who, they stay here in St. Louis, they only have a few doctors, they can work fine. The good thing is you have an option. I don't basically push one over the other. I try to show people what the differences are and let them decide.
If I'm traveling out of the country, does it matter? Will Advantage plans cover me in general, or should I be thinking about traditional Medicare?
All Advantage plans require worldwide emergency care, okay? And it's written into the plan. Most of the plans I have, if you need to go to an urgent care center in France, and they have them, or the emergency room in Germany, okay, you're covered, okay? Emergency care is usually defined as all care required to stabilize your condition till you can return home. So I've had examples of clients hit by taxi cabs in Prague, Czechoslovakia, and spent 11 days in the hospital and get a complete leg reconstruction with titanium rods and everything else. And he comes home, and all said and done, his total cost was maybe $120 for all of that, because it all fell under an emergency care condition. So Advantage plans are required to provide that worldwide emergency care, and that precludes most times the need for travel accident insurance separately. I've had clients injured on cruise ships and spend time in the infirmary on the cruise ship. That tends to be covered by that as well.
So with both HMO or PPO Advantage plans, there's no monthly premium, correct?
There are zero premium plans. Most of the well, that's not fair. The premiums run usually, of the 6 or 8 plans that I have, all right, the premiums run between $51 a month for a PPO. There are zero premium PPOs. And basically, the HMOs, there are some that carry a premium, but it's usually less than $20 a month. The good news is you get a Advantage plan. Your prescription drugs are included, so they're not separate, and all your coverage is combined into one area. It makes kind of, you're not following through with original payments from Medicare and then follow up from your supplement carrier. It's a pretty easy way to keep track of what's going on.
So the monthly premiums are negligible, but there are still out-of-pocket expenses as well with both of these plans, correct?
That is correct. These plans are predicated like original Medicare was, okay? They wanted us, the beneficiaries, to share in the cost, to have skin in the game, so that we wouldn't run off and be seeking out medical treatment that wasn't really necessary, because we were going to have to pay at least something towards it. And that's the Medicare Advantage plans do the same thing. So if you go in the hospital, you're going to have some copay that you're going to have to pay. The difference is the reason you needed to buy, when you were using original Medicare, that you might have wanted to buy a supplement, was because the original Medicare never had what we call a MOOP, a maximum out-of-pocket expense for the year. So your copays and coinsurance could keep coming if you were really sick. In an Advantage plan, they are required by the law, okay, to have a MOOP, a maximum out-of-pocket. The top MOOP under the current law is $6,700 for the year. But most of the Advantage plans that I represent and sell, the maximum out-of-pocket is usually somewhere between $2,300 and $4,500 in any given year. So what do you know when you sign into one of those plans? If you're getting into a zero premium plan, you know your cost is going to be somewhere between zero, and in the plan that I'm in, the max out-of-pocket, the MOOP, is $3,400. So I know that over the course of the year, if I stay healthy like I usually do, my premiums, my total cost may be very low. I think last year I had about $300 out-of-pocket total expense on my Medicare Advantage plan, all right? The worst one I've had in the past 5 years was about $1,300 out of pocket total, included premium and the expenses that I paid. So you have a range of what your costs might be, and you're going to share as you use services. But once you reach that MOOP, it pays just like having a Medicare supplement. It pays basically everything.
All right. You had said that there are 26 or so Advantage plans available in your area, but you've narrowed it down to, I think you had said 6 or so that you tend to recommend. How is it that you got and whittled it down from 26 to 6 plans that you like?
All right, 26 includes carriers that I don't represent every carrier that sells Medicare plans in the St. Louis market. I represent Aetna and United Healthcare. Humana's out there, WellCare, there's a few others. Most companies that offer, they're called plan sponsors, have 3 or 4, 5 or 6 different plans each, okay? So in my case, I have 5 plans in the St. Louis market with Aetna, and I have, or actually it's 7 plans, all right? And with United Healthcare, it's about 6 plans, all right? What I find is for most people, there's a group of about 6 plans that when you really analyze their situation, their health situation, they fit best within those. And again, I try to show all of those plans and we try to figure out, specifically. One plan may have their medication as a tier 3 and another plan has it as a tier 2. Well, can be a substantial difference. So we basically compare the plans and lay them out. One other thing that's happened over the years, people have, when I do that, they start to say, these plans tend to be fairly similar. And I say, yes, that's correct. All right. If you have an HMO, I have the 2 HMOs I sold most of. One has a $2,800 out-of-pocket maximum, and the other one has a $2,900 out-of-pocket. All right, and you get the ones that fall in the same category, and you'll find this one is a little bit better here, but this one is a little worse here. But this one's better here, and this one's worse here. And by the time you go through it, they tend to be fairly similar.
One of my fears would be if I was with an HMO and I had to stay within network. Let's say I'm diagnosed with something and the surgeon, she or he, is not in my network. I can go out of network and use that surgeon. Is that correct?
In an HMO, probably not. It would require literally moving heaven and earth. In a PPO, yes.
Okay.
Go out of network and use that surgeon.
So let's say what I've been diagnosed with is bad, but the surgery can hold off for a little bit until the next open enrollment period. Am I able to switch from an HMO to a PPO, or can I switch from an Advantage plan to regular or traditional Medicare if that's what I choose to do or need to do?
The answer is in Advantage plans, yes. Every year during annual enrollment period, you have the opportunity to switch to any other Advantage plan that's available in your area. The switching from a supplement to an Advantage plan is also easy because Advantage plans don't have any health questions. Well, they have one. Do you have end-stage renal disease? And that means, do you have imminent kidney failure? And the only reason they ask that question is because Medicare has some basic plans for people who are looking at kidney transplants or dialysis. And it works better for them if they basically drive most of the people into those plans. If you're in an Advantage plan and you want to switch back to a supplement and you are past the guaranteed issue period, which we talked about in that segment, okay, which is 6 months after you first become eligible for Medicare, now the Medicare supplement company has the right to ask you health questions. And based on your answer to those questions, they can rate you up, meaning charge you more than the standard rate. So making the switch from one Advantage plan to another Advantage plan, very easy, not much stipulation, even from one company to another company. That's fine. I do it every year during annual enrollment. I'll change one client from an Aetna to a United Healthcare and the other one from United Healthcare to an Aetna. But there are some conditions that you need to be aware of if you think you're going to want to go from a supplement to an Advantage plan to a supplement.
What are some of the reasons why people would change from an Advantage plan to a supplement plan or traditional Medicare?
In my experience, I'll get the phone call and it comes in, Randy, I just got this diagnosis. It's cancer. I just dealt with one yesterday. A client, he's been a client for 11 years, and he said, I've got cancer and it looks difficult. I'm 77 years of age, and should I try to get back to a Medicare supplement? And I said, the first thing that you got to look at is what is your max out of pocket, your MOOP. And in his case, it was $2,800. I said, if you went back into a supplement, okay, by the time you paid the increased rate, because you have to tell them that, yeah, I have cancer, and they raise the rate on you, you'd be paying about $500 a month for your supplement and your drug plan. And, do the math, that's a minimum of $3,000, $6,000. Okay. I said, why leave your Advantage plan? Your MOOP is your safety net. So that you got this cancer diagnosis, you're still fine. You know, you most of you're going to pay is $2,800, and after that, everything is on the insurance company. So that's always the discussion. I probably have 10 of those a year. People get concerned as should I go back to a supplement? And I say, if you want to, we can, and if you're willing to do it. But it's difficult for me to find a reason why they should. But if they want to, I'll do it.
Is there any difference in between supplement plans or traditional Medicare and Advantage plans when it comes to in-home care services?
Home care, medical services, and let's talk about what home care is. There's two types of care you can receive at home. You can receive medical care in your home. That means you have a nurse or a rehab, technician, a physical therapist come to your home to work with you to, recover from something. Those medical services are covered by the Advantage plans, and they're also covered by original Medicare and a supplement, right? The other form of home care is what we call custodial care. So I got so sick that I can no longer get up and go to the bathroom by myself, or I can bathe. That kind of care is called custodial care. That's not covered by Medicare. That's only covered by long-term care or self-funding. So medical home care is covered in these Advantage plans, okay? But that doesn't include having, people who cook for you, help you, take your shower and that type of thing. That's custodial care, and that's not usually covered.
Right. So that's private pay, or that is family, friends, and all those type of things.
Or long-term care insurance if you're fortunate enough to have it.
Right. Wow. All right. Well, that just about covers it. We've discussed 5 different topics in regard to Medicare. And again, to me, you and I have gone through this in 5 different times, and my head's still starting to spin, and I can imagine how everybody else is feeling as well. I feel like it's very, very important for someone to utilize a Medicare insurance agent, a licensed insurance agent who can walk us through this. And I know you feel that way, but sum it up for me in terms of why don't I want to take all this on myself, and why it's so important that they use someone like you to do this.
There's so much information that's floating around. Part of the reason why I'm a broker rather than what we call captive agent is I want to be able to put the client's needs first. Okay, if I do my job, okay, and I would love to tell people I am compensated by the insurance companies that I write my clients into. So that's why my service is free to them, and I get paid. I also have chosen not to focus on my commissions, all right, and just say, if I do the right thing and get these people into the plan that best suits them, and I don't tell them what to buy, I help them decide what to buy, all right? There's differences in plans. Even though on paper 2 plans look identical, there's like minor differences. Like this one says, well, we pay for dental insurance, but they only pay what is called a contracted rate for a crown. And another one simply says, we'll reimburse you whatever you pay. There's minor differences like that usually aren't apparent, and having someone who represents multiple plans will see those based on experience and working through it. There are some moving parts. I appreciate clients who do their homework, and they know a lot going in, and it makes the discussion easy. But I also am perfectly happy to start from square one, and if it takes 2 or 3 times a meeting to help them understand why. My goal was always this: I want my clients to understand why they chose what they chose and why they didn't choose what they didn't choose, that they have enough understanding that they made this decision. And obviously I'm an advisor. If they ask, I'll tell them, well, I happen to think this might be better for you, but if that's the way you want to go, that's fine. when I try to take the role as an advisor and an educator, and usually most people appreciate that enough, and they say, if I'm going to choose to do so, I'll do business with you.
Right. Yeah, you and I have the same mindset. I do a lot of consultation work, a lot of referral work. I don't get paid for that. I want to make sure that I'm positioning people the right way. And the way I earn my living is by selling a house. If there is a property to sell, then I'm selling a home. If not, I'm supporting my referral partners and making sure that people are being taken care of, and I'm sleeping well at night. There are other professionals that are out there that have the same mindset. When I go to show a property to buyers, I never look at what the commission split's going to be and how much I'm going to make. There are people out there that will actually look at that. And, I hate to say that they'll do it, but there are some people who will decide which homes they're going to show you based upon how much they're going to get paid. It happens. And that's not the right mindset. It's not the way to go. And I bet you don't know what you're getting paid on these plans either. It's not about you. It's not about me. It's doing the right thing. And that's one of the things that we're trying to stress here at the Senior Learning Institute, is that there's a lot of good free advice out there that you could take advantage of that nobody is benefiting from on this end, in regard to which plan you do, what you do. It doesn't matter. We want you to make informed decision. And that's what it's all about. I'll get off my soapbox. Randy, thank you so much for your insight and your expertise. As I've asked you in the prior 4 podcasts, if someone wants to dig a little deeper and pick your brain, what's the best way to get in touch with you?
They can call me at 314-496-0140, or they can email me at Randy_Schrupp, SCHRUPP, at MSN.com. And yeah, I will have my website, Schrupp Senior Services, upgraded probably by the middle of the summer. So eventually they can start going there and get some updated information.
Wonderful. So you can go to SchruppSeniorServices.com or go to the SeniorLearningInstitute.com and click on Randy's logo, and that'll take you right to his website. I want to thank you all again for listening to this Senior Learning Institute educational moment. At the Senior Learning Institute, we strive to provide straightforward and unbiased information. This is the information you need to make smart decisions the first time. Our whole goal is to connect older adults and their advocates to the resources they need without any cost or any obligation, and we mean that. So from staying put to selling the home in any condition, estate and financial planning, connecting you with care providers and care managers, estate sale services, clean out services, you name it, we refer nationwide without any cost to you. To learn more, please visit us at theseniorlearninginstitute.com. Until next time, I'm Ted Gottlieb, certified senior advisor, seniors real estate specialist, and founder of the Senior Learning Institute.